Let's look at these synovial joints. There's a number of things that all synovial joints have, so we'll start with that. Then we will look at some minor variations between different synovial joints. These variations largely depend on the shapes of the bones and what type of movement occurs at that joint. The study of movements at joints is called kinesiology. So when you learn about joints, you don't just learn the different joints and their structures, you learn more specifically what kind of motions occur. Synovial joints have a synovial cavity, and inside this synovial cavity there is a fluid known as synovial fluid. If we look at this general drawing of a synovial joint, it is actually taken from a finger. So this is known as an interphalangeal joint, a joint in between phalanges. You'll notice shown in here in yellow is where you would find the synovial cavity filled with synovial fluid. That synovial fluid is going to help nourish the cartilage, keep that cartilage healthy. It also is going to provide a little bit of shock absorption, and it also helps lubricate the joint. The articulating bones need to be covered with articular cartilage. So we see here wherever those two bones are going to make contact, they are covered with hyaline cartilage. So the specific type of cartilage is hyaline cartilage, but we often refer to it as articular cartilage because it is found at joints. The bones are held together by ligaments. There's a number of ligaments found at different joints. And we're going to see that learning ligaments is fairly easy if you know your bones and your bone markings. Many times the ligaments are named after what two structures that ligament is holding together. And then there is an articular capsule. So notice this articular capsule helps contain that fluid. There's also a lot of ligaments that help stabilize that connection, that articular capsule. But you need connective tissue to hold that fluid inside. All synovial joints are diarthrotic, meaning they allow a large range of motion. But under that heading of diarthrotic, there are various types of movements. And we're going to need to learn the different terms that are used to describe those movements. A couple of them you may have heard of is flexion and extension. So if you think of your elbow, that's what your elbow joint can do. It can flex and extend. But there's a number of other terms we will be learning in this PowerPoint. There's a variety of different types of synovial joints. These types of joints, again, are largely based on the shapes that form the joint, and then those shapes determine what precise movements are allowed. An example of a synovial joint type is the plane joint, also known as the planar joint. The key feature of a plane joint is that the bones are fairly flat when they make contact. And when they're flat, these types of joints allow more of a sliding movement. So plane joints have very little angular movement, very little change in the angle between the two bones. But instead, they slide back and forth or glide. Hinge joints. Hinge joints are much like the hinge on a door. And if you think of a door, it'll open and close. But in the body, a hinge joint is going to allow flexion and extension. The two classic hinge joints, which there are others, but the two hinge joints that you typically think of are your elbow joint, specifically between the humerus and the ulna, allows flexion and extension, but also the knee joint, which allows flexion and extension. There are a number of pivot joints in the body. A pivot joint allows rotation, which is going to allow one of the bones to, in essence, spin. One example is your proximal radio-ulnar joint, shown here. So here's the radius and the ulna. Pivot joints typically need some sort of a ring structure, which in this case it is formed by a ligament known as the annular ligament. And then the radius is allowed to spin inside that ring. And that allows you to turn your palm over or pronate. The other pivot joint we've heard of is the atlantoaxial joint, which is formed between your atlas and your axis. There is a condyloid joint in your wrist. A condyloid joint is very similar to a ball and socket joint. The key difference is the ball is more oval shaped. When you have an oval ball in an oval concave structure, it allows almost every motion except rotation. And this is a condyloid joint formed between your radius, which at the distal end of the radius there is an oval-shaped concavity, and your scaphoid and lunate. Your scaphoid and lunate form this oval shape. So you can do a lot of things at that joint. You can flex it, you can extend it, you can move it away from the body or abduct it, you can move it towards the body or adduct it. You can move your wrist in a circle, which is called circumduction. But the one thing you cannot do is rotate at this joint. There's a saddle joint formed between metacarpal 1, which is the metacarpal in your thumb side of your hand, and the trapezium, which is a carpal bone. Saddle joints are formed because one bone kind of forms a saddle in which the other bone sits. And saddle joints are very similar to condyloid joints in that they allow a lot of motion. One motion they do not allow is rotation. And then finally there are the two ball and socket joints, where now you have a nice round spherical ball sitting in a nice round concave socket. And the two ball and socket joints are your shoulder joint, or glenohumeral joint, and your hip joint, which is formed between your femur and the acetabulum of your hip bone. So those are the different subcategories of synovial joints. What we need to do before we look at some of the specific joints is to learn the different terms we used for the motions or the movements at joints. So this is all kinesiology, studying the motion at joints. Gliding is more of a sliding back and forth between bones. Usually the bones are just flat or slightly curved surfaces. A lot of gliding movements are found in your wrist, where your carpals just kind of slide back and forth against one another. This is the example of a motion that allows very little to no angular changes between the bones. This slide shows flexion, extension, and then hyperextension at various points throughout the body. Usually you think of your elbow, so that's shown right here in panel C. Your elbow joint, you can flex and extend. Flexion is decreasing the angle. So you'll notice we have decreased this angle between your humerus and your radius and ulna. If we increase that angle, that is known as extension. So flexion and extension are opposite angular motions. You can flex and extend your head. That's largely done at the atlanto-occipital joint as well as your cervical joints. You can flex and extend at the shoulder. So when you lift your arm up like this is flexion. Extension is bringing it back. This joint will actually allow some hyperextension as well. You can do those things at your wrist. Flexion and extension and hyperextension. Your hip joint, much like your shoulder joint, in that it's a ball and socket joint that allows a lot of motion, but you can flex your hip, you can extend your hip, and you can hyperextend your hip. Notice some joints allow hyperextension. Other joints do not. We do not like to hyperextend at the elbow. We do not like to hyperextend at the knee. That's when ligaments are torn. The knee joint is a hinge joint. It flexes and extends, and then you can also laterally flex the torso using intervertebral joints. So these are all different pictures, all different locations, but what's in common is we can flex, extend, and in some cases hyperextend at these joints. The next combination of movements are abduction and adduction. I will point out the only difference in these two words is a B versus a D. Abduction is moving that body part away from the midline. So when you move your arm away, that's abducting it. When you move your arm back, it's adducting. You can do that at the wrist. Remember, your thumb is lateral in the anatomical position. So if you move your hand out that way, you are moving it away from the midline, and that is abduction. If you move it towards the midline of the body, it is adduction. You can abduct and adduct at your hip, and you can abduct your fingers. In this case, the midline is the midline of the hand. So these fingers are moving away from that midline of the hand. They are moving towards the midline of the hand. Circumduction is fairly easy. It's moving a body part in a circle, which is actually a combination of many movements all occurring in sequence. But your ball and socket joints are really good at circumduction. You can move your arm in a circle. You can move your leg in a circle. So that's circumduction at the shoulder and hip. Finally, rotation. Rotation, by definition, is moving that bone along its own vertical or its own longitudinal axis. So you can rotate your head. That's moving your head side to side. You can rotate the humerus, which is, I like to think of it as a twisting of the humerus. You have to differentiate rotation from circumduction. It's not a circle. It's a twisting of the bone along its own axis. So in this picture, we are, or she is, laterally rotating her humerus, kind of twisting it away from the body, and medially rotating the humerus, twisting it towards the body. You can also do that with your leg. So this is kind of a hard picture, but look at her foot. It has laterally rotated. That leg is, that femur specifically, has laterally rotated away. And then in this image, she has medially rotated it back towards the midline. So that's rotation. You'll notice that pivot joints can rotate, and ball and socket joints can rotate. Some special movements, just at certain joints, we like to use these terms. Your TMJ, your temporal mandibular joint, allows elevation and depression. So that's, if you are chewing your food, you often elevate and depress the mandible. You also protract and retract the mandible. So your mandible, or your TMJ, is actually a hinge joint. It kind of opens and closes. It also has a planar, or a plane joint portion, where it can slide forward and slide backwards. It can also slide side to side, which we call lateral excursion. Your feet have a number of special movements. Inversion is moving or lifting the inside of the foot, or the big toe side, off the ground. Eversion is lifting the opposite side off the ground, kind of that lateral side off the ground, your little toe side. And then dorsiflexion versus plantar flexion. The dorsum of the foot is the top of the foot. The plantar side is the bottom. So if you move it towards the top of the foot, that's dorsiflexion. If you stand on your tippy toes, in essence, you are plantar flexing. Finally, your palm has a couple special movements pertaining to rotation. So remember, when you do this, when you supinate and pronate, that's happening at your radial ulnar joint. But when you turn your palm up or anterior, that's called supination. When you turn your palm down or posterior, that's called pronation. And then finally, we've probably heard of opposable thumbs. We have opposable thumbs. Opposition is moving that thumb across the palm to meet up with your other fingers, like your little finger. So those are all movements found at synovial joints. This just shows definitions of each of those movements. So I'm not going to go through these descriptions because we just did, but this is a really good table to review so you can better understand these movements at different synovial joints. Here is another good summary table showing the different categories of joints. This is specific to all the different synovial joints we just went through: plane joints, hinge joints, pivot joints, condyloid, saddle, and ball and socket. It gives a good description, largely the shapes of the bones that come together. It gives the motions that occur at those joints, and then it gives an example or two of each of those synovial joint types. In the next video, we're going to just look at some very specific locations, especially the joints that at one point or another you will hear about because they tend to bring about some problems to individuals.